Good evening, ladies and gentlemen. Welcome to Reference Point. I'm your host, Dave Cokerhook, and this evening we're going to be having a second half of our conversation with Nadia Al-Samarre, who's the editor-in-chief of Diabetes Health magazine. So Nadia, thank you for coming back and joining me on the show for this second segment talking about diabetes. Appreciate your being here.
Thank you for having me.
Now, what I wanted to start with was just to go back to something we mentioned at the very end of the last show. You were talking about the in Hawaii, one of our 50 states, which is a glorious and wonderful place to go visit. But you said something about kids who were born in the year 2000 or something like that. Give me that statistic again.
The children that were born in the year 2000, 50% of them is estimated that they will be diagnosed with diabetes.
50%? Mm-hmm. I mean, that's ridiculous. That's
Absolutely.
huge.
It is ridiculous.
that's like...
It's staggering. They're the Pima Indians that also have that
wow.
ratio. 50% have diabetes.
And something else that we were talking about just a few moments ago before the show started was that, and actually we mentioned it in the last show, that there was an increase in diagnosis of diabetes in India and China. And I was sort of asking the question as to whether or not the influx of US-based fast food places may have some impact on that, and we were talking about that. And really, what I jokingly almost was saying that seems to be actually one of our major exports is the way we eat, you know. And so we've got Americans love to travel. We are we have military bases all over everywhere, and so the GIs, the guys and gals, are going to want what they're familiar with, and so these places are popping up everywhere, and there is this apparent correlation, and I can see that. It makes a lot of sense because we eat a lot of things that we probably shouldn't. Yeah.
And for the people that are experiencing McDonald's for the first time in a foreign country, you have to realize for them it's a unique experience. So it's an American experience.
Right. Yeah. Yeah. Interesting.
It's like Disneyland coming over, but they're
Ronald McDonald and the playground and that sort of thing. All right, let's talk about the magazine a little bit. You had mentioned just before we started that from the physical magazine that there is a couple. There's the Diabetes Health, which is targeted toward the individual, the patient, and then you have Diabetes Health Professional, which is targeted toward the medical community. Is that correct?
Correct.
And when you target the medical community, are we looking at nurses or doctors or all of the above? And what's the objective there?
Well, for the we reach out to the primary care physicians, nurses. Primary care physicians will see a lot of people with diabetes, and they need to know about 2,000 diseases, and to stay abreast of all of that can be very challenging.
Wait, say that again. They need to. Oh, you mean all the things that they need to know about?
All the things that they would need to know when they're seeing someone. There are all kinds of possibilities.
And diabetes is just one of them.
Diabetes is just one of them. So as a publisher, my job is to educate them, and we write articles that are easy to read, that they understand what's going on in research, business briefs, what's coming up in the market, therapies. We have patient perspectives. We have healthcare professional perspectives. So
to what degree do the healthcare professionals, doctors, nurses, I'm going to put chiropractic into that because they deal a lot with physical ailments and stuff like that. To what degree does that profession have a grasp of what diabetes is and all about, and what they can do to help a patient?
Well, it really depends how many patients you see. I think if you're not seeing a lot of patients with diabetes, then you probably aren't as I'm just a presumption that you
presumption that works.
Presumption that if you're less likely to see a lot of people, then you're less likely to stay on top of it. I mean, time is money, so you're going to focus on where you need to put your efforts with your patients. Certified diabetes educators also work with physicians. So if you have a primary care physician who has a nurse that's a certified diabetes educator, she could be very helpful and useful. And in many circumstances, physicians will work with a certified diabetes educator, and they will defer to her to really do the training and the coaching and just the emotional support as well.
Can you be misdiagnosed? with respect to diabetes? Or is it pretty cut and dry? You either have it or you don't?
Well, people have been misdiagnosed, yes. Is it really common? I don't think so, but we hear of people being misdiagnosed. And sometimes a type 1 being misdiagnosed as a type 2 and not a type 1.
And let's help the audience again redefine the difference between type 1 and type 2.
Type 1 they used to refer to as juvenile diabetes. Their body doesn't produce any insulin,
Right.
and so they're insulin dependent. Type 2s, their body still produces some insulin.
Mm-hmm. But an insufficient amount to be able to do the work that it needs to do in order to process the sugars in the blood and stuff.
Correct.
Okay.
To normalize the blood sugars.
So does that mean that type 1, if the body isn't producing insulin, is that something that has developed over time because of things that you have done? You got sick and you had this disease, illness, or you don't have been eating right, or is it more of a genetic implication there on type 1?
Type 1, I think that's a billion-dollar question, honestly. If they knew the answer to that, they would have the solution for that. They don't really know. Sometimes people have said it could be from trauma, it can be genetic, it can be environmental.
Wow.
It could be, some people say the inoculations that you give your kids.
Okay. So there isn't an easy answer to that one. Too bad. I was thinking
Right.
that one might be an easy one.
Right.
No such luck there.
No.
All right, let's go back to the magazine. Diabetes Health Professional, targeted toward the healthcare professionals. And now this one has been on the market or in publication for how long relative to diabetes health itself?
It's a good question. I believe 2004.
Okay, so this has been maybe the last
10 years.
10 years, okay. And then, but Diabetes Health Magazine has been in publication since, what did you say, 19 something or other?
Yes, 1990.
1990, okay, so that's been around much longer. And why did you decide to do one for the health professional?
Because there's some issues that are different. And when you write for a healthcare professional, what you're doing is you're trying to share information that other healthcare professionals use in being successful with their patients.
Oh, okay.
And we also write certain inspiring stories for them. We featured healthcare professionals and what they do.
Mm-hmm.
And they're also more interested in the conferences that we go to. So generally we'll write, the American Diabetes Association has an annual conference, and so does the American Association of Diabetes Educators. So what we do for those healthcare professionals that wouldn't necessarily go to those conferences, we write out those conferences for them.
So you give them synopses of what occurred and keynote
What
information
occurred,
and some of the new developments and products and things.
New therapies.
New therapies. Okay, cool. And then for the online magazine that you have that's targeted toward the pharmacist, okay, is that parallel to what the diabetes health professional does, or it's similar, or what are some of the unique things that you do for those people?
Well, for the pharmacists, we look at the industry as a whole in terms of what pharmacies are doing, what chain pharmacies are doing, what independent pharmacies are doing. We have research that, in terms of that supports certain environments where the pharmacists work in a collaboration with doctors to prescribe. Typically, pharmacists cannot prescribe.
Right.
But there's some situations, like if you work for the government and you're in a pharmacist there, you can work with a doctor. And so they will write about their outcomes, and then what we will do is we show the support that working in collaboration with a physician can really get better outcomes. And it also is very cost effective. You have a healthier patient, it costs less, and the team works together efficiently.
Well, that's good. I'm assuming, and because I don't know, I'm going to make an assumption, which is always dangerous, but the pharmacist is going to understand to a high degree whether if a patient is on other medications, does what he or she is looking to be prescribed for their diabetes situation potentially come in conflict and things like that. Is that
Correct.
something that goes? Yeah.
Correct. The pharmacist is the most underutilized healthcare professional. They're very well educated. They can have a tremendous amount of impact. If you're working with a health organization, let's say it's not Kaiser, because Kaiser has everything integrated.
Right.
So if you're working with a non-Kaiser or an HMO, and you have a doctor that gives you a some type of cholesterol medicine, and then you go to a different doctor and they give you a different heart medicine. And so the pharmacist that's looking at these two things will look at them and say, hey, these two aren't going to work together. So then the pharmacist has to call one doctor and say, there's a conflict here, I need you to change your medication. And sometimes the doctor will say, call the other doctor. And ask them to change their prescription.
Yeah,
so
sure.
It becomes really more of an ego thing rather than really taking care of the patient.
But I can see where the collaborative thing that you were talking about, where the pharmacist has become an integral part of the medical professional team, would have a tremendous amount of positive impact for the patient. That's
the role is so important, yes, because they're dealing directly with the patient. They're dispensing the medication. They can see the conflict. They can see the problems, which may not be as obvious to physicians or healthcare professionals that are really busy. Because sometimes what happens is they're looking more at the micro perspective of the patient, where the pharmacist is looking at the macro perspective.
Right. So now let's go to Diabetes Health Magazine, which is the one that the consumer, the individual, might refer to. And in there you're going to be having what kind of material?
We have, well, our tagline is to investigate, inform, and inspire. And we love to inspire people. We all need it. It's always great to read a story about somebody that made one little change and it changed their lives dramatically. Or
somebody that may have diabetes that you didn't even think that if you had it, maybe you couldn't do anything. There's one of your prior magazines here that's got a picture of Jay Cutler on it, who's when he was with the Broncos, but he's a professional football player. He's a quarterback. He's still playing.
Right.
He has diabetes, but that doesn't mean just because you have diabetes that you can't do aggressive things like this.
Yes, there are lots of great athletes there that have type 1 diabetes, and that's really part of the education too. So you have to realize if you have a child that has diabetes, the fear is that your child is going to feel limited in what they can do as they grow up.
Right.
So the people that are out there doing things, challenging themselves, will inspire the young people, but more importantly, they give hope to the parents.
Sure.
Years ago, I was on vacation in Hawaii with my family, and we sat down next to a family that their son had type 1 diabetes. And they were so elated to find out that my former husband, Scott, had type 1 diabetes because they had never met a grown man with a family and kids.
Oh.
So that was something that they were really happy about, so they can just say, look, doesn't stop you from having a family.
Right. Very cool. That's very cool.
And the athletes, the super athletes or the not so super athletes that just are disciplined and having fun and really doing it just to challenge themselves,
right,
are just wonderful role models. We tend to write about, I call them everyday heroes. We write about a lot of people that they're not famous, but they're just inspiring, insightful, articulate, and I love reading their stories.
How does someone get a copy of this magazine? I mean, it's online, right? It's
online. Yes, you can go to diabeteshealth.com and sign up for our e-newsletter. And what we do is we'll deploy that out bi-monthly. So every time we get a new issue, we'll send you a copy of that.
Got it. And you will find it at your healthcare practitioner's place, but it's free. I mean, the consumer just, if they're there and it's there and they have they want to have the copy, they can just walk out with it, right?
It's a big part of my distribution model. I've worked with healthcare professionals for 22 years. When I owned my business, Sugar Happy Diabetes Supplies, I used to go and market to them and introduce my business and let them know that I knew that they were busy, and if they wanted to send their patients to me, that I would train them on all the products, the medical products. And then when we had the radio show, we did the same thing. We went to the medical community and said, we just want you to know we have this show, and if you want to let your patients know, they can call in. And the publication, we send out 600,000 copies a year to healthcare professionals that use it as an educational resource.
Oh, fantastic.
And in fact, the demand for the publication could be a lot more. I mean, monthly, bi-monthly, well, I could send out 330,000 issues a month.
Wow.
But as an independent publisher, I just have to, 600,000 is the...
There's only so many that you can actually print and get out there and manage to...
Yes.
You mentioned supplies. Okay, that was part of what your previous business had been and stuff like that. And I'm sure you talk a lot about that here in the magazine. And one thing that I found very interesting, and we actually had a conversation about this sometime before we were doing the show, had to do with the fact that there are so many insulin products. I mean, it's not like there's just one, but are they all the same? I mean, if you're getting insulin from supplier A versus supplier B or C, you're getting exactly the same thing and it really doesn't matter for the patient? Or are there nuances that, depending upon your circumstance, Ms. Patient, you should be going over here rather than over there? I don't know if that's a fair question or not. But I think,
well, most people, the choices are predetermined for them.
Oh, so their doctor prescribes it.
Well, and yes, their doctor prescribes it, or you're limited by certain brands.
Limited by certain brands?
Being able to use certain brands. So perhaps a pharmaceutical company will work with an organization and say,
oh, I see.
Okay,
so this HMO or this medical clinic group only I see.
We use the Bayer meter.
I see.
We use the Nipro meter. We use the LifeScan, the one-touch meter. So it really depends.
So it's not a question of one being superior to the other, it's more a question of how they have managed their distribution channel.
Right.
Which is reasonable.
Right. That's right. So they have contracts with them. We do have one of our signature publications is coming up. It's our annual product reference guide, and we're going to be putting together our 10th annual product reference guide.
Okay.
And what we do with this is that we collate all the information for people with diabetes. We don't rank. We don't recommend. What we do is we just collate the information for them so they can thumb through in one area and see all the different products. Now, the nurses love this that work in hospitals, because what they will do is they'll take our insulin charts out and they'll post them at all the stations.
Okay.
Because again, they know a lot of the nurses may not be familiar with all the diabetes products. So they use a lot of the charts that we have in our annual product reference guide. And
so the annual product reference guide is good not just for the patient, but also for the medical professionals
Healthcare
as well.
professional, yes. December, January, we're putting together our diabetes health and 10th annual product reference guide, our diabetes health professional 10th annual product reference guide, and now we're adding the pharmacists.
Oh, wow. Very cool. That's a lot of work.
It is. It's fun, though.
Yeah?
Yeah. I like products. It's interesting.
Well, and that's where you started the activity, is in the product side.
Yes.
So you mentioned that there are conferences and things, and you go to some of these conferences? Why? Because they're very interesting. You meet a lot of people that are doing different things, research, you see what's working. Generally, the speakers are there to share something that works, that can help you be a better practitioner. And so our job is to be there and to learn that and to write about it for our healthcare professionals. And then we can also take the same type of thing and change it and offer it to a patient from a patient's perspective. So you can take something where they can say, you know, when you go into the hospital, make sure that you have a blood glucose, or make sure that you well, one of the examples is that I really liked is that UCSF did this study, and what they found was that they had their patients that had type 1 diabetes, they were having problems with their blood sugars. And the reason why they were having the problems with blood sugars was because people would bring in food and they would eat, and the insulin wasn't there, they weren't testing their blood sugar, so it wasn't really, it was disjointed. So, this is one of the things that they were teaching the healthcare professionals, and they said, oh yeah, that makes sense, we should certainly change our protocol.
Well, from the patient's perspective, we can write and say, hey, you know, when you go into the hospital, don't eat. You know, get your blood sugar, make sure you have your reading. And if they're giving you the wrong foods, let them know that you have diabetes.
Right.
And educate them.
There are certain people with certain health conditions that have the, you know, like a medical information disc or bracelet or something like that that they wear. Is that something that for diabetics that's useful or important or relevant?
Yes, people wear it, but that's really kind of more of a vanity issue. It's just it's a question: are you a diabetic or are you a person with diabetes?
Okay, got
There's
it.
some people that are creative that have tattooed it.
Is that a fact?
That felt that's more
how fun
artistic.
Is that? There you go. So when you, but if you're going as someone who has diabetes, if you're going in to see your healthcare professional for something entirely disrelated, or you're on a trip, you're taking a cruise, and you come down with something or something happens and you're going to the infirmary, it's always important to communicate to the person that's going to administer to you that this is a condition that you have. Is that correct?
Yes, yes. Well, and you always have to fill out a form telling them what your conditions are.
Right, right. Okay, good. So what's the next phase for you? You're not doing radio anymore, are you? As far as the radio show. But are you doing anything in other medium other than the print medium, well, hard copy and digital print? Are you doing, there's a lot of information that's available that you have, okay? And I'm wondering if you have a set of like, you know, 422 3-minute YouTube videos, each one touching on a different topic that might be relevant for someone that they can search and say, oh, I need to know about this or I need to know about that. Are you doing that?
I would like to do more of that. We do have a strategic alliance with YouTube where they approached us and asked us to produce more videos. So that's something that we definitely would like to do more of.
Very cool.
The thing that I'm very excited about is creating some Kindle books.
Oh.
So I have about 21 different ideas for books to...
Addressing what?
Well, type 1 diabetes, for people, type 2 diabetes, inspiring stories for type 2s, inspiring stories for type 1s.
Sort of like chicken soup for the soul for the diabetic.
You know, parenting a child with diabetes.
Oh, okay. That's very
recipes.
You know, we actually haven't talked about that kind of part of the impact. We actually are down to the last few minutes of the show here. But from the standpoint of the family dynamic, if you have one or maybe more than one person that has diabetes, and you know you have a family of 4, you know, mom, dad, 2 kids, and one of the kids has diabetes. So do you need to really change the whole scenario for how you're managing your the food plan and the meal plans and all that sort of stuff? And or can do you prepare separate meals for the person that has it? I mean, these are questions that I think people might have. I don't know how you would address that type of a circumstance in a family dynamic.
Well, if your child has diabetes, the parent always wishes it was them that had it, not their child.
Sure.
So secondly, what they will do is they will change the family lifestyle to accommodate it, so everyone's on this similar diet. And people they will tell you also that diabetes is not necessarily the worst thing to be diagnosed with. It could, for the type 1, you know, that's a separate story, but if you have someone in the family that's overweight, has prediabetes, and their child has type 1 diabetes, then having to change your diet and eating healthy and eating well is a blessing for that person. So it really depends. And
it's actually good for everybody else too.
It's good for everybody else. I had a gentleman that submitted an article about his wife who has type 2 diabetes, and he was just saying what a blessing it was for all of them because they were both thinner, healthier, happier, more active.
So in the last couple of minutes here, what is, or some of the things, if someone hasn't gone regularly to get checked up at their physician, what are some of the early warning signs that you might want to consider that you need to go and get this checked out?
Excessively thirsty is one of the symptoms. Frequent urination, blurry vision, being lethargic, depressed. Those are some of the symptoms. And then having a family history. If someone in your family has it, that definitely.
There's a good chance that it might be.
Yes.
Okay.
Everyone has a 1 in 20 chance of getting it, but if it's in your family, it becomes 1 in 5. So you kind of move up.
Really?
You move up to the line there.
Really? That's interesting.
So you definitely, if it's in your family, you definitely want to get it checked out every year.
Okay.
And generally they say 40, over the age of 40 and older, to get checked every year.
So if you're just going in for your regular physical and the doctor's drawing blood and you went through the tests and they, you know, and they come back normal, if they come back with something, they would tell you, basically.
Yes.
Because you may not know necessarily that you are moving in that direction, because
That's right.
you may or may not feel different physically.
Right. Well,
Okay.
pre-diabetes is like that. Yes, you're teetering. You don't quite have diabetes, but your blood sugar is a little high.
Right. So we have just a little over a minute left, Nadia. So I'm going to ask you if there's anything else that you would want to communicate to our viewing audience regarding this topic.
Well, I would encourage people that have family members and partners to learn more about diabetes and be a support system, because diabetes is a burnout disease, and it's really nice to have a partner or a family member that can be supportive. The more they know, the more you can help a family member, a neighbor, a partner.
Great. And with that, I want to thank you for coming and joining us for these 2 segments of Reference Point to talk about this subject. And ladies and gentlemen, I hope you have found it interesting and you've learned something, as I have, about the prevalence of the disease, and what you actually can do to decrease the probability of something of type 2 anyway, happening for you and your loved ones. So Nadia, thank you again for joining us at Reference Point. And ladies and gentlemen, if you have any questions or queries, send us those emails at info@referencepointtv.com, and we'll see you next time on Reference Point.